Guide to the graphic. Here in purple we have a presentation of an entryway in a house with the left edge obliterated. And below, a presentation of the left edge of a human body, including the left arm and hand. Unilateral neglect. Unilateral neglect is the inability to integrate and use perceptions from the left side of the body or the left side of the environment. This deficit may occur independently of visual deficits or may be compounded by left hemianopsia. However, it has been found that even in patients with seemingly intact visual fields, there is a reduction in the flicker frequency, dark adaptation, and motion perception, so that even patients with seemingly intact vision may, in fact, have a deficit. A patient with unilateral neglect will ignore the left half of his body. For instance, he may forget to shave the left side of his face or dress his left side. Unilateral neglect may occur in the left half of his extrapersonal space, so that the patient will neglect the food on the left side of the plate or read starting in the middle of the line. He may bump into things on his left or constantly be turning to his right. Someone with unilateral neglect differs physically from a patient with a left homonymous hemianopsia because the former has seemingly intact fields of vision, whereas the latter has a blindness in the left-sided fields of both eyes. It appears that the patients with this hemianopsia might still receive full or adequate sensation from his left side and may automatically compensate for his visual fields. On the other hand, the patient with unilateral neglect may have diminished sensation on his affected side, thus compounding the problem and forgetting that side. This patient is usually very slow in learning to compensate for his disability and, in fact, may never fully incorporate his left-sided personal and extrapersonal environment in his functioning. Unilateral neglect may also be a syndrome that occurs in apraxognosia, a deficit consisting of several different apraxia and agnostic syndromes, all centering mainly around a lack of perspective. Lesion site, inferior parietal lobe of the right, non-dominant hemisphere. And that's unilateral neglect. Have a great day.